Welcome to the Deep Dive. Today we're tackling a story, a health announcement actually, that seems to have, well, really taken scientists and doctors across the world by storm.
Yeah, it's huge. If you're expecting a child or you know someone who is, you understand just how much thought goes into every health decision. It's a lot of pressure. So imagine the reaction when, on Monday, the White House drops this highly anticipated statement. President Trump urging pregnant people to avoid Tylenol, acetaminophen, if possible, and the reason, a claimed possible link between this incredibly common painkiller and autism.
Right. And this didn't just appear out of the blue, did it?
No, not at all. It fits a pattern. The administration, especially with HHS Secretary Robert F. Kennedy Jr., has really zeroed in on finding environmental or maybe pharmaceutical causes for autism. He's often talked about getting answers for families, sometimes even touching on theories like the debunked vaccine link, and definitely pushing back against the scientific mainstream's focus on genetics. And that context is just so vital here. Because when you have major health policy guidance like this, seemingly running ahead of the established science, it creates immediate confusion, real high-stakes confusion for people. So our job today, our mission, is really to pull apart those claims from what the actual scientific data says, because the overwhelming message we're seeing from researchers and our sources is that this announcement, frankly, outpaces any science that could solidly back it up right now. We need to figure out what the data really supports and understand why so many scientists are, well, sounding the alarm.
Okay, let's get specific then. What exactly did the guidance say? Avoid Tylenol unless you have an extremely high fever.
That was the gist of it, yes. Avoid it if possible, except for those extreme fever cases.
Though we should probably clarify, current medical advice already suggests talking to your doctor before taking acetaminophen for pain or fever during pregnancy. That's standard practice.
Absolutely. That part isn't new, but the strong warning, the link to autism, that was the bombshell.
And they didn't just say what not to take, right? Were there alternatives suggested?
They did offer something. The other part of this was promoting leucovorin. It was positioned as a potential therapeutic for children already diagnosed with autism.
Leucovorin. What is that exactly?
It's actually not new. It's a folate-based medication, decades old, that basically mimics folic acid. You often see it used alongside some chemotherapy drugs.
Oh, interesting. Not to treat the cancer itself.
Exactly. It helps restore essential nutrients, specifically addressing the body's folate pathways, which chemo can disrupt.
Okay, so folate pathways.
Yeah.
How does that connect to autism? What's the theory there?
Well, the idea, which has some support from smaller research groups, is that maybe some children with autism have issues with how their body metabolizes folate. And folate is crucial for brain development. So leucovorin could theoretically help get around those metabolic roadblocks. And it has a pretty good safety profile because, it's essentially a form of a B vitamin.
Has it shown any promise in studies?
There have been a few small clinical trials, yes. And anecdotally, some parents and investigators have reported positive results, suggesting it might improve symptoms.
But. I sense a but coming.
A big but. The evidence is really, really limited. One of the key studies often cited involved fewer than 50 patients. That's tiny. And there's absolutely no consensus that it works across the board for everyone on the autism spectrum. It's very early days for that research.
So it feels like the administration is really working from this core belief, this premise, that there must be a single culprit, a specific environmental toxin or a drug like Tylenol causing the rise in autism diagnoses.
That certainly seems to be the driving narrative.
And it aligns perfectly with that whole Make America Healthy Again focus, which often points fingers at pharmaceutical drugs for childhood illnesses. They're offering a simple cause, Tylenol, and a potential fix, leucovorin.
And positioning it directly against the established scientific view, which RFK Jr. has even accused of gaslighting mothers who are looking for answers. It's a powerful political message.
Okay, so that's the political frame. Let's pivot now. Let's dig into the science itself behind the Tylenol claim. What does the evidence actually show?
Well, this is where it gets murky. Researchers consistently describe the link between Tylenol and autism as unclear or muddy. There's just no scientific certainty there yet. And importantly, the established medical guidance right now today still recommends Tylenol as the go-to, the first-line treatment for pain or fever during pregnancy, as long as you talk to your doctor. That hasn't changed based on solid evidence.
Okay, let's unpack this.
Yeah.
Because the administration must be basing this on something, right? They wouldn't just invent it. What studies are they pointing to?
They are pointing to some studies, yes. Primarily observational studies. There was a systematic review that got a lot of attention.
A review, meaning it looked at multiple studies.
Exactly. It reviewed 6 observational studies, and one of the co-authors was actually the dean of Harvard School of Public Health, which give it some weight. And that review did conclude there was a statistical association between taking Tylenol during pregnancy and a later autism diagnosis in the child.
How big were those studies?
The largest one included in that review looked at around 73,000 children across Europe. So yeah, not insignificant numbers.
73,000. That sounds like a lot.
Yeah.
So an association was found.
An association, yes. But, and this is the critical point the scientists keep hammering, finding an association is absolutely not the same thing as proving causation.
Explain that difference. It sounds technical, but it's clearly crucial here.
It's everything. Think about it like this. Ice cream sales and crime rates often go up at the same time in the summer. They're associated. But does eating ice cream cause crime?
No, of course not. It's the hot weather causing both.
Precisely. The hot weather is the confounding factor. It's the hidden variable driving both outcomes. Association doesn't tell you why two things happen together.
So how does that apply to Tylenol and autism?
Well, the huge confounding factor here is often the reason someone takes Tylenol in the first place during pregnancy, usually fever or significant illness.
Oh, okay.
Fever itself, especially high fever, is already a known risk factor. It can potentially impact fetal neurodevelopment.
Right.
So if a pregnant person gets a bad fever, the known risk, and takes Tylenol to treat it, these observational studies struggle to untangle whether any later neurodevelopmental issues like autism were linked to the fever itself or the Tylenol used to treat the fever.
They can't easily separate the drug from the reason the drug was taken.
Exactly. It muddies the water. And this is highlighted by the largest single study done on this specific question.
Which one was that?
Published just this year, 2024. It looked at 2.5 million children in Sweden, a massive data set.
2.5 million. Wow. And what did that study find?
After carefully controlling for those confounding factors, including the presence of fever and other maternal health issues, they found no statistically significant link between Tylenol use during pregnancy and autism.
Okay, wait. So a review of studies, including 73,000 kids, suggests an association, but a single, much larger study of 2.5 million kids, designed to control for confounders, finds no link.
That's the conflict in the data right now. And it shows why jumping to a causal conclusion based only on the association studies is scientifically problematic. The bigger, better controlled study points the other way.
That really highlights the uncertainty. And it creates a practical problem too, doesn't it? Because pregnant people are already told to avoid other common painkillers.
A huge practical problem. They're strongly discouraged from taking NSAIDs like ibuprofen, especially later in pregnancy, because those do carry known serious risks for birth defects.
So Tylenol is often the main or sometimes the only recommended option for managing pain or, crucially, bringing down a dangerous fever.
Right. And if you discourage its appropriate doctor-advised use based on this shaky autism link, what happens? You might be increasing the risk from the untreated fever itself.
You're potentially trading a theoretical, unproven risk for a known, tangible one.
That's the concern many doctors have voiced. It seems like a policy decision creating a potential health dilemma on the ground. And, if we connect this back to the bigger picture, this intense focus on Tylenol kind of misses some really important context about why autism diagnosis rates have gone up so much over the past few decades.
Yeah, that increase is undeniable. The numbers are stark. What were they again? From maybe 0.5% in the 90s.
Right, around 2 to 7 per 1,000 kids back then.
To roughly 3% today. Like 1 in 35 kids. That's a massive jump.
It is a real increase in diagnoses, but the overwhelming scientific consensus points to 2 main drivers, neither of which is a single chemical exposure.
Okay, what are they?
Number 1, vastly increased public and professional awareness. We just know more about autism. Doctors are better at screening for it. Parents are more aware of the signs. And number 2, probably even more significant, the diagnostic criteria itself has changed dramatically. It's been broadened over decades.
Broadened how?
Well, historically, the definition was often very narrow. Think back to Leo Kanner's original descriptions in the 1940s, heavily focused on things like speech delays and very specific behaviors.
So it missed a lot of people.
It missed huge numbers of individuals who didn't fit that precise, narrow mold. Over time, the definition expanded to include a much wider range of social communication differences, restricted interests, sensory sensitivities, what we now understand as autism spectrum disorder, or ASD.
So it's a spectrum now, capturing more subtle presentations.
Exactly. As the net got wider and more nuanced, it naturally included more people who previously wouldn't have met the stricter criteria. That accounts for a huge portion of the increased numbers.
That makes sense. It's better recognition, not necessarily a sudden epidemic caused by one thing. And our sources mentioned other known risk factors too, right? Like parents having children later in life.
Yes, advanced parental age, both maternal and paternal, is consistently linked to a slightly higher likelihood of having a child with autism. That's another well-established factor.
Which, again, contrasts sharply with the administration's hunt for a single smoking gun chemical or drug.
It does. Most autism scientists are pretty skeptical of that single environmental cause theory. They argue that if something that widespread and impactful existed, like a common medication causing this big rise, we likely would have found clearer evidence by now through rigorous studies.
And the scientific community's reaction to this announcement itself has been quite strong, hasn't it?
Incredibly strong, very unified pushback. We saw quotes from groups like the Coalition of Autism Scientists.
What did they say?
They put out a statement saying the announcement alarms us researchers. They explicitly stated the data cited do not support the claim that Tylenol causes autism and leucovorin is a cure.
Strong words.
Very. They went on to say the policy only serves to stoke fear and falsely suggest hope. That's about as direct as scientific bodies get.
So if they're not focused on Tylenol, where are the leading autism researchers putting their energy and resources?
Overwhelmingly, genetics. That's where the bulk of the evidence points.
Genetics. How significant a factor is it considered?
Estimates vary slightly, but multiple large-scale studies suggest that genetic factors account for around 80% of a person's overall risk of developing autism.
80%. That's huge.
It is. Scientists have already identified hundreds, literally hundreds, of genes that are associated with the development of autism or autism-like traits. The current work is really about understanding how these genes interact with each other and potentially with environmental factors on a smaller scale.
Which is almost the opposite direction from where the administration and RFK Jr. in particular seem to be looking. Didn't he call genetics research a dead end?
Yes, he has dismissed the primary focus on genetics, calling it a dead end, for finding answers people need now. It's a fundamental disagreement on where the most promising research path lies.
And there was something about the timing of this announcement, too, wasn't there? Related to a big government review.
Right, that adds another layer of concern for many scientists. The National Institutes of Health, the NIH, had actually commissioned a massive, comprehensive internal review of all the current science on autism, causes, risk factors, treatments, everything.
Okay, that sounds like exactly the kind of thing you'd want before making a major policy announcement.
You would think, but our sources confirm that this huge NIH review was not finished when the White House made the Tylenol announcement.
So they went ahead anyway, before their own experts had finalized their comprehensive assessment.
It certainly looks that way. It strongly suggests that delivering some kind of answer fitting their preferred narrative was prioritized over waiting for the complete consensus-driven data from the government's own top scientists.
Okay, this is a lot to take in. So what does this all mean? For you, the listener, trying to make sense of this, what are the key takeaways from all these sources? Let's try to boil it down. One, that link between Tylenol and autism, it's still very much unclear. The largest, best-controlled science we have right now does not support a causal link, especially when you factor in things like fever. Two, the big increase we've seen in autism diagnoses over the years, the scientific consensus, is that it's mostly driven by much broader diagnostic criteria and way better public and clinical awareness, not some single environmental toxin. And three, despite this White House announcement, the current established medical advice hasn't changed. Doctors still generally recommend Tylenol as the safest option for pain and fever during pregnancy, but always in consultation with your physician.
That really sums up the state of play based on the science. And the core message here, I think, is the importance of critical thinking, especially when you see health policy or political statements getting way out ahead of the careful, peer-reviewed scientific process. It's particularly important when we're talking about medications that are commonly used and used by vulnerable groups like pregnant people. You need solid evidence before making drastic changes to guidance. And maybe here's a final thought, something provocative for you to mull over as you see future health news. The administration may be dismissing genetics, right? Calling it a dead end. But right now, as we speak, there are clinical trials underway around the world testing highly personalized gene-based therapies for some forms of autism and related neurodevelopmental conditions. It's a completely different frontier. So, considering that genetics likely accounts for up to 80% of the risk, what's the responsibility of government? Where should research funding go when politically favored theories, like this single chemical idea, clash so strongly with the main thrust of scientific consensus, which is pointing towards complex genetics?
That's a deep question about priorities, funding, and the intersection of science and policy. Definitely something to think about. Thank you for diving deep into the sources with us today. We'll catch you next time on The Deep Dive.